The inclusion of diversity, equity, and a sense of belonging is very important to any training physician. I think in order to foster that, it's important to be around similar-minded people or people who have similar value systems. I'm from generations of farm workers. My grandparents, their children, including my parents, were all farm workers in California dating back to the 40s. And so I just had this long history and shared knowledge of what life is like. In the residency, I will be the inaugural chair of the Diversity, Equity, Inclusion, and Belonging Committee. The goal of the committee, it's an inaugural committee, a part of this endeavor, and so there is so much opportunity to learn and find best practices with the goal that when the students arrive here, even before, that staff around them, staff in the hospital who may not directly be interacting with them, those who will be training them, those who will be evaluating them, those who will serve as mentors, all have the support to foster training physicians, understanding that diversity is extremely important in our healthcare field and in our physician workforce. Giving them a sense of belonging and inclusion is also as equally important. And so the role of the committee is really just to have a heightened awareness to that. Underrepresented physicians is a chronic problem we have in our country, and particularly in California. To change that needle, it really will require that the trainers, the facilities, the students, the trainees themselves, all are really dedicated in showing up to improve diversity. And so I really see the committee as an opportunity to look at all things that we do through a lens of recognizing what we still need to do in the field of medicine.
The More in Common Alliance is a historic partnership between the Morehouse School of Medicine and the Common Spirit.
And the purpose of the More in Common Alliance is to address the health inequities that exist in communities across the United States through research, through education, through community outreach, and certainly in the space of clinical education. We are looking to increase the number of residency programs that are designed to train physicians who are culturally humble and are able to meet the needs of the communities where their residency programs are located, and later to practice in those communities to further meet the needs related to health inequities in those communities.
This program will help with the mission of leading the creation and advancement of health equity, touching the communities in the food deserts, in the medical underserved areas, the health deserts, the underserved patient population, the migrant farm workers. These are people that will benefit from this program.
The community too will benefit, because as these physicians provide culturally competent, compassionate, culturally humble care, they then will be able to benefit and better relate to the patients who they are caring for. They may have similar experiences through life, through circumstance that the patients who they will care for have, and in that way will be able to relate in a way that improves outcomes. It's not only the clinical care that these physicians provide, but also the medical education through community outreach, the mentorship to high school students and to college students who are in the area so that they can see physicians who look like them and can see themselves becoming. So this is one of those intangible benefits that sometimes we don't think about when we consider the presence of a physician in a particular community, but those are among the benefits that we always must think about as we consider the programs that we're starting through the More in Common Alliance.
And so that really is a true opportunity we have in this program, is not just to train, but also to create leaders and those who will continue to have the desire and fire to keep this work going.